I'm Mark Walsworth. I'm a second-year resident here at Kootenai. This is my wife,
Megan.
And then this is our daughter, Amelia. Can you say your name, please?
My daughter, Amelia.
We're in downtown Coeur d'Alene right now. Behind us is the library. We have probably the biggest, most extravagant, fun park. In front of us is Sherman Avenue with a lot of really cute boutiques, shopping, and wonderful restaurants, coffee, tea, wine.
Downtown Coeur d'Alene kind of blew our minds when we first came here. We didn't know anything about Idaho. We didn't know anything about the program. And so, we're bummed that you can't be here with us, because this is what really convinced us to come here. It was our first drive through town with the leaves kind of just starting to change. Completely took our breath away. I love walking around downtown. It's close, everything is within like a pretty good walking distance, and again, like this whole area is extremely family friendly, so it's very easy to get around with a stroller, with a young child, with an older child. There's plenty of things to do. That's also a really great place for community engagement. At the library, they do a bunch of kind of public events where they will read children's books, where they do a lot of kind of outreach and reach out and read kind of programs. And it's a really easy place to get involved here in the downtown.
My first impression of Coeur d'Alene was bursting, colorful leaves and trees, and just the sheer beauty of the fall and the end of the summer. The next thing was just relationally, as soon as we came here and we met the people that we could possibly be friending and working with, they were all just wonderful and amazing and welcoming, and it just made me feel right at home and so comfortable. I mean, that's why I wanted to rank Coeur d'Alene first.
That was my thought as well. The kind of personal relationship we got a feel for immediately upon coming, whether it was with Dr. McClandress, any of our other faculty, or our future co-residents. Everybody seemed to be really interested in who we were really supportive of us as a family, and
welcoming to me as a spouse and my daughter. Them, Dr. McClandress, just knowing our names before we even introduced ourselves, spoke volumes to me.
And I think that's one of the things that we end up missing a little bit without being able to interview in person, is this really kind of personal care that you get from faculty, co-residents, from everyone in the admin. Everyone cares about us as people. It makes us feel really good about being here, that we've chosen the right place. And it's something to look forward to, both during the time that you're thinking about applying here, when you're interviewing here, and especially if you end up deciding to come here.
We're here on the North Idaho College campus. It's a beautiful campus. They offer full nursing degrees and a lot of other really amazing health degree opportunities, and you can finish 4 years of school here.
North Idaho College is an extension campus for Boise State University, University of Idaho, and Lewis and Clark, 3 kind of large schools in Idaho. It's a really beautiful place. The lake is just a hop over that way. All sorts of fun things to be done on campus as well as right here in the surrounding area. For those of you with significant others, this is a great place to either start or finish up a degree, especially if you are leaning towards something in the healthcare field, as Kootenai, where we would be working, is right down the road and associated with a lot of the nursing or MA kind of programs here.
Coeur d'Alene has a wonderfully rich history here. This used to be all Native American tribal lands. There were French settlers here, and they were fur trappers, actually, that gave the Native American tribe the Coeur d'Alene name.
The local tribe is still called the Coeur d'Alene tribe. As a residency, we try to do a lot of work down at Mariman Health, which is traditionally on Native American land at one of the reservations, and we do a lot of care for the Native American population, and anytime somebody from Mariman Health ends up admitted at Kootenai, we take care of them as a residency in the hospital. And part of our first year of residency, we have a couple folks from the Coeur d'Alene tribe come in and kind of give us a backstory about their rich history and how the tribe has kind of ebbed and flowed and changed over the years. We're here at the Ray and Joan Salvation Army Kroc Center, aka the Kroc Center. This is a place where we go all the time. We got a membership as soon as we arrived here in early June. Got a pretty good deal on it that includes pretty cheap childcare. Megan and I can come here whenever we want, and they have really early hours for the resident schedule, and they're open pretty late. My favorite things to do would be using the basketball courts or, doing like a stationary bike to get a quick workout in.
I really enjoy the running track and taking Amelia to the swimming pool, and the rock climbing wall is amazing. I recommend that to everybody. And there's a great lazy river for after a hard workout too, which is really fun, and some water slides.
Apart from all of the kind of gym stuff that the Kroc Center has, they also do a bunch of community events. So they have a theater inside, a full church that has weekly services, and then they offer some community classes as well. And for those folks that either don't have a family yet or don't have kids or significant others, Kootenai offers a discounted gym service at Peak Fitness, which is like 5 minutes of a walk away from the hospital and the clinic, at around $15 a month. So it's extremely cheap, really easy to get into that as well.
We're standing on the Centennial Trail. It's one of the most beautiful spots in Coeur d'Alene. It goes all the way from the east side of the lake all the way into Spokane. It's about 60 miles, and it's very, very biker friendly, stroller friendly, runner friendly. It's one of my favorite places in Coeur d'Alene. So beautiful no matter what part you are on.
And speaking of biking and walking to work, tons of us as residents bike and walk to work. I walk every single day. I live about 5 minutes away from the clinic, 10 minutes away from the hospital. It's a very easy jaunt, and that makes it really easy to just live with one car with just Megan, Amelia, and I. Their favorite thing, or at least Megan's favorite thing, is when I go and bring home coffee after work from Big Blue, or they get to stop by early in the morning and grab coffee with me on my way into work. So
Big
it's really
Blue.
nice to be that close.
Best coffee in town.
We're here right in front of Coeur d'Alene Lake. Tons of boats and a nice little harbor out to that side. And Coeur d'Alene is very large. We are seeing a small part of it over here, but it's a beautiful lake. We love to be here, and Tubbs Hill over there is just over to our right.
Tubbs is probably our top favorite hike of the area. It's so close to home. If he gets off work, we get ready and come down here. We can be here in like 5 minutes. Quick hike before the sun goes down. It's like 2 miles and over 100 acres of land. You can go up and over it. You can go around it. It's beautiful lake views around the entire thing. But that's not the only hike we have in town. There are hikes all through Coeur d'Alene and the surrounding areas, from hiking in your flip-flops to hiking with like your thickest hiking boots. There's every option.
We just took a big trip this last weekend, myself, a couple residents, and a couple of our spouses, to the top of Scotchman Peak. So that's kind of on the higher end of what we enjoyed doing. We had to, bring cold weather gear, a full lunch, tons of water, and got up to the very top of Scotchman's Peak, which I think is around 7,500 feet in elevation. And that's kind of a little bit farther away as far as hikes go. This is one of our closest ones, 15 minutes walking from work. A very, very short drive. And then Scotchman's is more like 2.5 hours away. And we have a ton of beautiful lakes in this area as well.
So much boating, swimming, fishing, kayaking is one of our favorites. Some of our resident friends love paddleboarding and just chilling on a tube.
One of the best draws of this area is the fact that it's really easy to get outside, quickly outdoors, even if you've been working long hours in the hospital. Never that hard to find a parking spot. It never feels overdone, and it's really easy to kind of escape into nature. So that was one of the big draws here. And even in the wintertime, skiing is really popular. We've got a bunch of ski resorts in the area for those of you who are into skiing or snowboarding or any kind of winter sports. Our residency is relatively small. We have 6 residents in each class for a grand total of 18 residents at a time. I feel like that's a really big strength of our program. We're really well connected with each other. My class especially feels like people that I'm going to have as lifelong friends, and people that I would do anything for. We feel well supported by our faculty and staff. It's a really kind of close-knit family. And I think the size of our residency has quite a bit to do with that we kind of have to be close to each other and that we all feel really, really well connected.
We definitely were beyond blessed to be here and meet the people that we now call our family more than friends. I feel like if Mark is working, I have like 10 extra people on our emergency contact list, and I feel comfortable asking one of them to come help me pick up a bed from the thrift store, or whatever it is. We were very, very close and share our lives together.
This is a great place to be. We're really happy that we came here.
Yeah.
And we're really sorry that you can't join us. This is a wonderful residency program. Everything about it from top to bottom just makes us feel at home, safe, well supported, and we hope that you'll consider us in the future.